Hey, on today's podcast, we might discuss some topics that are a little bit graphic in nature, so if that's something that you don't want to listen to, listener discretion is advised. Well, this is a real deal fire, like things could go wrong here.
Fire was,
Getting bad.
He needed to get out of there.
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
I don't know, there's been lots of scary things. Everybody always asks, like, what's the scariest thing you've ever done as a fireman?
What is the scariest thing you've ever done? Is it a fire or is it a medical patient?
So it's different.
One of each.
Yeah, so scariest fire I ever had. So the fire side is going to be more scary, like, to my safety, right?
Yeah.
I mean, obviously, you might have a victim or something in there, but in those situations, you're certainly concerned about your safety, right? Or your crew's safety, your guys' safety. The first time you ever fired a real fire. So I had actually just graduated fire academy, and I was volunteering at a small department, and me and another guy that went to academy together, he was actually the guy that kind of got me into the fire service.
Okay.
We went to academy together, and they were like, hey, we just graduated fire academy, we're firemen now, right? Mm-hmm. So we thought, let's go to the station, and we'll spend the night at the station, see if we get a call. Well, sure enough, the night I graduated fire academy, sure enough, at like midnight, we get a structure fire call. And so we literally, I'm going to date myself here, we actually had an open back cab engine, right?
Okay. I have no idea what that means.
So you know the cabs on an engine now, it's all fully enclosed.
Oh, yeah,
right?
Yeah.
So old engines, the driver, used to be, they were fully open, but this engine, the driver officer compartment was an enclosed cab, but the back, the tailboard section, where the two firefighters would fit facing backwards, it was an open cab. It had no top to it. Right?
Thank you for educating me. That makes sense.
Yeah. So anyway, that's dating myself because those haven't been around in a while. Anyway, so I get in the back and get all my gear on, and we're going to this fire, and we show up, and there's smoke showing. Like, it's a legit house fire. Now, it wasn't like ripping out a window or anything dramatic like that, but there was definitely a fire in that house. And I remember going up to that door, and one of the other more senior guys coming up, and he had fought, actually it was the guy that I had gone to fire school with, but he had been a volunteer for a while, so he'd actually fought some fire. I hadn't really.
Right.
And he was like, well, you ready? And I'm like, I guess so. And he boots the door. He donkey kicks the door, right? Yeah. And I just remember thinking to myself, like, oh, this isn't training. Like, they can't just shut the fire off, like at training. This is the real deal. And so it was no big deal. We went in the house, and we went down the hallway. It was a room and contents fire. The room burned up pretty good. It was mainly kind of smoky. We put a little bit of water on it. It wasn't anything real dramatic. But I do remember being like, oh, this isn't like, this is for real. This is a real deal fire. Like, things could go wrong here, right? And then probably as, my career progressed, I remember a fire we had in a district I used to work in. Came in the middle of the afternoon I don't know how it works in your world. Mm-hmm. It seems like the bad calls, the ones that you'll remember that turn into bad calls or scary calls or things, they don't ever come in like that.
Yeah. Like,
you don't get called out to a 5-alarm fire and it turns out to be like this. I'm sure that happens, but a lot of times you get called out to like benign stuff, like, oh, this is just some run-of-the-mill thing, right? And like that trauma patient I brought you, where it's not single vehicle accident off a road, cars on all 4 tires, like, this is no big deal. And we walk, oh my God. Like, one of the worst trauma patients I've ever seen, right?
Yeah, it was bad.
We get called out to a residential fire alarm. Middle of the day, bright sunny day. So we're cruising over there. As we're going, they bump it out as a structure fire. So we're thinking, okay, might be a little bit something here. Pulled up, little bit of smoke coming out of the front door. Occupants out of the house. Hey, I don't know where it's coming from, but there's I just got home from work. There's smoke inside my house. Okay, cool. Captain does. He's doing his 360 thing. I'm pulling a line. We get to the front door, and I get to the front door, and I can see perfectly fine inside the first floor of this house. To the rooms that I can see no problem. Again, a little bit of light smoke, nothing crazy. Captain, who was a 20-year captain out of Phoenix before he came to our department. So this dude's seen some stuff, fought some fire, right? Yeah. We're going in with the line to try to find the seat of this fire. he comes around out of the back, and he's like, it's back in that room, and it's hot in there. And to me, like, when that guy says it's hot in there, I'm thinking, oh, this guy fought fire in Phoenix. He's probably seen some fire, right? So we go into this back room, me and the guy who was backing me up on line, we go through, I'm on the nozzle, and we go into a back master bedroom, and it is pitch black. It is bright and sunny in the rest of this house. Daylight. This isn't in the middle of the night. And we go into this room, and you could not see your hand in front of your face. Wow. It was black. And I'm like, oh, this is different. And it was hot back there. So we're on the floor. We're doing a right hand, kind of going around. And we hit these doors, and we just so happened to open up these doors that went to a bathroom and then a closet. Well, that's where the seat of the fire was. Mm-hmm. And I didn't see it, but the guy behind me saw it. And as those doors open, fire just comes ripping out over my head. And he's like, he wished he would have had a picture of this. He's like, that was the coolest thing. I didn't get to see it. I'm over here pooping my pants. I'm in it, peeing myself, like screaming like I'm about to die. And that was, it was a little bit scary, just because you really could, it was like training.
You said you couldn't see it. Were you aware of the danger of what was happening?
Well, you're aware just because of training. Like, you're in a room, it's the middle of the day.
But you couldn't see the fire, though.
You know there's a fire in here somewhere, and you can't see anything. Yeah. And that
But your partner could see it, though. He saw the flames.
He couldn't see anything until we opened up those doors. Once we opened up those doors and it came rolling over my head, then I could see everything. And we had a great vent team. They came and ventilated. We got the fire out quick. No big deal. But that was pretty spooky. Yeah.
I was talking to a firefighter from Canada at the conference that I was just at. Yeah. And I asked him this question.
The scary question?
Yes.
Okay.
And he told me, it was interesting. It was a fire, and as a fully involved as a house fire. It was one of those houses in Canada, like, I feel like, it seems like every house does this. The split level.
Yeah, that's how we had in Illinois. Yeah,
I had the same house in Seattle growing up.
Yep.
So he was on the top level, and he went into a bathroom.
Yep.
Couldn't see anything.
Oh, yeah.
All the smoke. And door closed behind him, and he could not find the doorknob. He's like going around, he's like, what in the world? He could feel the bathtub, and anyway, and the fire was,
getting bad.
He needed to get out of there.
Yeah.
And he was getting scared.
Sure.
And I'm probably missing a bunch of details because I'm not a fireman, but the way he described it, he's a really good storyteller.
Yeah.
Bigger than life.
All the elements.
Anyway, he went into the bathtub. Is that something you would do if you can't get out of a room?
Listen, I'm not judging anybody for doing what they think is right in the moment. So, yeah, I'm not saying that that's a technique that we train on, but hey.
I don't know why.
It would, if you have no hose line and you can't get out, it provides you some level of protection.
Anyway, he was so scared. He described it. Anyway, I guess, he ended up breaking his back because the bathtub went through the ceiling into the kitchen.
Oh, okay.
And he broke his back.
Oh, man.
And it was quite you could see it was a really intense story. But when they came back and I guess looked at the fire, it's an incident kind of, we go back and look at
NIOSH or one of those. Yeah, right. Anytime there's a firefighter injury like that.
This guy had designed the bathroom. It was all tiled in. The whole bathroom was tile. And the doorknob wasn't a doorknob. It was like this. You had to push the tile, and the thing came out. Oh. So there was no way he could have known.
Oh no! There's
in a normal bathroom. He was, anyway. So So yeah,
that's why it's important to have a partner keep that door open while you're searching a room. Have a tip ready.
He shared that, and that's a scary moment.
You and I both know a certain training chief from a department that we are very well familiar with.
The one we spoke of earlier today.
The one that we saw earlier today.
Oh, saw.
That we were in his office today.
Oh yes, okay.
And he has a very scary story about a house under construction where he got trapped in a room and literally thought he was going to die. Literally thought he was going to burn to death. And because same thing, he couldn't find the door because it was under construction and it was very confusing. Yeah. And great learning lesson, and that's unfortunately that's why we learn a lot of lessons is through bad things that happen to other people. So you have those, fire calls that are scary, right? Yeah. Like I say, from our standpoint, or you're worried about your guys.
Your own safety.
Yeah, our safety, my crew safety, things like that.
And I think that's why you are a hero because you're putting your life in harm's way to save people and property. I mean, wouldn't you say that's...
I mean, I don't think any
I
fireman
don't think
would
you
sit there
view
and go,
yourself,
"Oh,
but no, the general population, though.
Yeah, that's fine.
That's why they view you.
Yeah, we just think
you're
it's
putting-
cool because we're like a bunch of 10-year-old kids that
Okay,
want to go.
I get that.
Yeah, that's, we just want to go have fun and
Right.
break stuff.
But
and,
the fact that you'll put yourself into these situations, that's why people
Yeah.
will call you a hero.
yeah,
Would you agree with that? I mean, that's why they say it. I know you don't...
Guess, I don't know. It's weird, but to us, I mean,
true,
we don't
though.
even think about. I don't. You certainly think about the danger of what you're doing, but you're almost more. I mean, like you're excited to go do what you want to do. It's kind of like being a soldier, or
Right.
being a Marine. Like it sounds maybe a little sick and twisted, but you've trained all this time to go to war. You want to go to war.
Right.
If you're a firefighter and you do all this training to be a fireman and all this stuff, right? You want to go fight fire. Right?
Mm-hmm.
You want to do the cool stuff. That's why you get into the fire service. You don't get into the fire service to, do some of the more boring stuff, unfortunately.
Sure.
I mean, it's certainly part of the job. But yeah, I mean, we have those fire calls that are scary, but like I say, they're scary from our safety perspective. But like scary patients or, being scared for a patient, that's been another things I've had to do that were scary. Like I was scared, I don't want to hurt this patient, right? Different level of scare. Like I'm not worried about my safety now. I'm worried about my patient and doing the right thing by them. And this is a scary procedure or something, just like you as a doctor. Like first time you've ever intubated somebody, I would imagine that was scary.
I remember that.
Do you remember the first time you tubed somebody?
I do.
Was it like a RSI or cardiac arrest or?
It was, I actually, to be honest, it was a long time, decades ago. But I remember it was I was training. I was a medical student still, and the attending physician let me intubate. And it was, I guess, an easy intubation. I don't even know the context because I was just a newbie medical student.
In the emergency department?
Yeah.
Okay.
My clinical rotation, so it's probably my third year or fourth year or something like that, and I just remember feeling so scared.
Oh yeah.
Like everybody's watching me.
Oh yeah.
A lot of
Pressure's
expectations with no experience, and I remember I did it. I'd practiced and on dummies.
Yeah.
And I got it and put the tube.
You practiced on firefighters?
No.
Oh, on mannequins. Oh, I'm sorry.
Terrible.
I can say that.
No, because you are a firefighter and you're not a dummy. Anyway, I got it. I don't remember the disease, but I do remember feeling really scared, feeling like, well, even though I was nervous because the first time I had that opportunity to do that, something I always, as an ER hopeful, was scared of doing.
Sure.
There's a certain level of comfort having the attending physician there behind me.
Absolutely.
It's kind of like when we were holding rattlesnakes in Sweetwater.
Yeah, Dennis.
I was scared, but I felt safe.
Right.
It was Dennis, Dennis.
Well, it's kind of like the theory of like an FTO, right? Like I go out and I got a bunch of young medics and, they've never intubated anybody or taken an airway, and so it's helpful to have that senior guy in the back there going, it's okay. Let's walk through it. I remember bringing a patient into you one time, and a friend of ours who works for a company, I don't want to say his name, but he was working in the ER, and we brought in a patient, and you guys ended up intubating him after I brought him in, and you were walking this PA through the process of doing that. And I'm sure he may have done it before, but you could tell he was new, and it's that same mind. It's always nice to have kind of that safety blanket there that oh boy, if something goes wrong here, I've got him to fall back on.
But even when you are that experienced FTO or the experienced ER doctor teaching somebody a new skill, there's also a certain amount of humility you have to maintain, because you never know when you're going to get that patient, that airway.
You can't get the airway.
Right.
Then you're calling at him.
Have I told you the story about this patient came in, a patient with cancer who'd had a lot of radiation treatment. And when you get a lot of the radiation treatment, especially when it's in the head and neck area, it can cause a lot of. It's almost like the skin turns into plastic and
stiff and hard and
this particular patient was stuck in a very kyphotic so you couldn't see his neck at all, and he was he needed to be tubed. and the paramedics that brought him in couldn't tube him
Yeah.
because of his position.
Sure.
But they were able to ventilate him with an eye gel.
Hey, there you go. The goal is not to intubate, it's to ventilate sometimes.
Well, it was hard to get that thing out for me
The
to
eye gel?
try to intubate again.
It was hard to get the eye gel out?
Yeah. I
Oh,
mean,
wow.
this guy was so. I mean,
Oh, wow.
it was almost. I felt like, how did they get it in?
Yeah.
Well, I went to try to intubate. I couldn't see anything. The guy was in such
Now,
a.
this
bad-
is manual, too. This isn't even video.
I was using video.
Oh, it was video. Okay.
I was using
It was
video.
that bad that you couldn't
Yeah.
see anything with video. Wow.
You have to understand. I mean, it was just.
Yeah, yeah, yeah.
It was just.
So
it was
how
in the
did you have
worst
him positioned? Flat? Did you have him raised up? What?
Yeah, elevate the head of the bed.
Yeah.
You know, you the whole tragus at the
Yep, yep,
angle of
yep,
Louis.
yep.
Had the textbook position,
Yes.
but he was not
So,
in
yeah,
anatomic position,
You can't change this. Yeah, right.
and I could not do it. So and then I couldn't get the eye gel back in,
Oh, no.
and so I thought, well. So I remember we put in a nasal trumpet. We were ventilating as best we could, trying to
Nasally
bag him
intubating.
back up.
Was he breathing at all?
He was breathing on
Why
his
did
own.
they take away nasal intubation?
But
That's a great tool.
well, actually, I was setting up for what's called a retrograde intubation.
Yeah.
Where with a like a Seldinger technique with a wire and grab. Anyway, but before I could complete that procedure, which we were setting up for, the wife came in and said he's DNR,
Oh,
and and then I did end up getting the eye gel back in.
oh, that's good.
And,
yeah. I mean, we're not trying to be
yeah,
insensitive,
yeah.
but sometimes that's the best.
yeah.
Yeah, cool. We were actually just talking about this. I brought a patient in recently to a facility and was talking with the ER provider, and they were, to the general public, it sounds like a crude thing to say, but they were like, this patient just needs to die, But I mean, like, it's hard to face that reality, when people get to that. I've had that conversation with people that, oh, what would you do if it was your dad, and you got to tell them, like, hey, everybody gets to that point in life, and how much do you want them to suffer? Is this, so that's a difficult thing. This guy, obviously, no, maybe not quality of life, but
No.
we all have an expiration date, I guess is my point. So you just eye gelled him, done deal.
Yeah,
Didn't
the
get
patient
the
was admitted for comfort measures,
Yeah,
and
yeah.
it was, and they'd been through. You could see in talking to the wife. I remember thinking to myself, she has been on a tough road,
Sure.
and this is going to be the end.
Yeah.
In this stay,
Yeah.
clearly, and
Yeah.
they. So those are hard patients.
Oh man,
Yeah.
Yep, super hard, and it's hard to deal with the family in those situations too.
She was really. She seemed to have a real good
grasp of
what was going on.
Yeah.
Yeah. So, but as far as scariest patients go, man, there've been.
Remember, you had the kid, you had the guy in the car wreck.
Yeah, there's sometimes I remember a 9-day-old
Yeah,
that was
9-day-old.
Yep.
Oh, I don't
It
remember
was
that
a
one.
day shift, and mom and dad brought their baby in,
Mm-hmm.
lifeless, limp, gray, and handed him to me.
Yep.
Brought him into
It's a fun
Trauma
feeling.
Bay 12. And,
When you're the guy, isn't that a fun feeling when you're the guy?
and mom and dad were nurses,
Oh wow, okay.
and they were standing behind me.
ooh, judging,
and-
watching.
Yeah, it was heartbreaking.
Oh yeah,
Heartbreaking.
So not breathing.
Yeah, not breathing.
Okay.
And I knew the moment I saw them, it was not going
Like not breathing at all, no pulse, like full cardiac arrest. Okay, 9-day-old. How many weeks?
We
gestation?
tried, and we did all we could.
Was it like a full term baby or?
Oh yeah.
Okay,
Yeah, full term,
full-term,
9-day-old, normal. That's probably what it was.
Okay.
Yeah.
Yeah.
But those situations are heartbreaking for different
Oh.
reasons, I think. But I think as far as sheer terror
Like-
or being scared, it's like, oh, here we go.
Yeah.
Some of oh man, there's just so many patients. That one I was just thinking of was a baby that. So it was a patient in the ER. I got to be careful with details, for HIPAA and all that.
Yeah.
But one of the baby was ejected through a windshield,
Right.
and it was found by a good Samaritan who's at the scene of the accident in the shoulder, and the pajamas actually had been on fire. It was charred and burned. Baby was still alive on the shoulder, and
Is this the one the cops found?
yes,
Yeah.
and that particular
Yeah.
law enforcement officer had to go lot of counseling.
Sure.
And, I mean, he watched mom die in the vehicle. They couldn't rescue her. And I ended up treating dad and baby and some other people at the scene of the accident too. And but I remember, so the Good Samaritan got into the patrol car with that officer, and they raced to our hospital, banged on the ambulance doors, handed me the baby, and we went to Trauma Bay 11. I still remember very clearly. And actually, Adam, one of our, we resuscitated that baby. We got him shipped out and to a local pediatric hospital, and died a few days later. Ended up dying of what ended up being brain. He had a intracranial hemorrhage from head trauma through the windshield. Just non-survivable.
But that was just scary because it was a really bad trauma, and it was a kid.
I mean, singed, like, second, third degree burns to the whole head.
Did you tube it?
And tubed right away.
Okay, got the tube.
Because just like singed. It's not just singed nose hairs, like singed face. Like, okay, we're tubing him
right now.
And we tubed the patient. Access. Little femline, and we got the baby sent out.
IO lines.
IO would be.
Femoral though, or that'd be a great
distal
line
femoral would
depending
be
on protocols.
But that was I remember that being
any skills that scare you? Like if you have to, like, cracking a chest open, I would think that would be pretty scary.
I've been a part of those, but to be honest, as an ER doctor, that's a heroic measure. That the trauma surgeon has always been there with me. I've never done one by myself.
Oh, okay.
So those have not been scary. Now, if I had to pull the trigger to do an ED thoracotomy, which I'm trained to do, that would be. That's pretty intense.
Yes, I would imagine.
There's a procedure. It doesn't sound like a big deal. It's called a lateral canthotomy. Have you heard of this before?
Yeah, with the eye.
Cut the eye.
You've done that before, though.
I have, but
that would be weird.
Cutting the eye. Well, it doesn't sound like a big deal, but there's something about cutting the eye. And I'd never done the procedure outside of studying it, and I'd never even done it on a cadaver. And I'd watched YouTube videos, and I'd studied it as a resident.
Never done it even in practice,
Never actually had the opportunity to do it. It's one of those procedures that you could go a career and never have to do it. And it's the reason you do it is to decrease the pressure on the eye. Anyway, I was helping out with another ER, level 1 trauma center in a state, not here, it's another different state, and was called with a group of us to go out and help fix this ER. They were struggling, and the first patient there's a transfer that was accepted.
First patient that walks in
needed bilateral.
Guess what you get to do today?
2 of them.
Oh my gosh!
And I knew it too. And they hadn't done it at the previous facility.
That's why they shipped them out. I don't want to do this. Send them over to the next guy.
I wonder. I don't even know if they thought about it. But when I saw the patient, the eyes were just, you could see the pressure, and so. You can measure the pressure in the eye with a tonneau and we needed to do this emergently. And fortunately, there was an ophthalmologist in but that procedure, I remember thinking to myself, "Oh, here we go. I'm gonna do it twice." And but the ophthalmologist did one, and I just kind of mimicked him. And it went really well. But that was a procedure I was a little nervous of.
I don't think so.
But not. As far as scary, it's really the simple procedures that are very difficult. Like an intubation is really a simple procedure, but can be very complicated and difficult. And so those angioedema cases are those where it's like, well, here we go.
And I think I think most paramedics, like intubating people, depending on the system you work in, you're probably a little bit nervous if you don't do it very often, but like crikes or doing needle decompression or finger thoracostomies or pericardial centesis, like these are, you might do now. Finger thoracostomies, you might do those more regularly, but like criking somebody, I mean,
often.
That's not going to be very often. I had one that I did, and I remember that was kind of a weird feeling when it was like, we knew the minute I bagged this guy, all that air. First off, the call came in as a choking. Right? So but most of the time you get there and then, they've cleared the obstruction, they're good to go. Not this gentleman. He was in full cardiac arrest when we got there. And so we knew there was a potential obstruction. Tried to bag him. Like, I mean, unlike I'd ever bagged anybody before, there was nothing going in. And so we all knew, like, this is an obstruction. Yeah. Tried to intubate him, all the things.
Chunk of steak or something down there.
Couldn't get anything past. And so we knew, like, okay, we got to do this. But even when you know, you got to do it. But I had a trauma surgeon one time in a cadaver lab kind of break it down, like, made it a little bit easier to grasp that basically, look, the worst has happened. The patient's in cardiac arrest, they're dead. It doesn't get any worse than dead. The only thing you can do is maybe help them. You're not going to kill them any more than they're already dead, right? Yep. So this procedure might help them. So do it, right? Yep. And to me, that kind of was like, okay, well, that's true. Like, what I'm doing, I can't harm them any more, really, than they've already been harmed. So, you know, we did it. It worked. It worked great, you know. Got the tube in. The guy actually got Ross back on the guy. Unfortunately, he had gone too long, had a noxic brain injury, but whatever. But yeah, that was a scary procedure. Doing that was spooky. Yeah. So anyway, sometimes you just got to do what you got to do.
I had a patient not too long ago that, it's a couple of years now, I guess. Ended up requiring 120 units of blood.
Oh, we talked about this.
Yeah,
that was a lot of blood.
Crazy, sick. Definitely the sickest trauma patient I've ever had that left the hospital totally intact, you know, and fine. Yeah. But
eventually. Yeah.
I mean, ED thoracotomy, pericardiocentesis, 4 chest tubes, intubated. It brought in and they tried to intubate and it went out. I mean, it went out of his trachea into his neck and they were pumping air into.
Sub-Q emphysema.
Oh yeah, I mean, this is a bad
day.
In a bad way. Yeah. Bad way. Oof. That was a crazy sick patient.
Yeah. It's fun. Fun. It's scary. I think is part of the reason why we do it. You know, getting that little bit of an adrenaline rush and doing the neat things, doing the cool things. I would think it would be the same as a doctor.
We're all part of the same community, pre-hospital, ER. We're all emergency services. Yeah. We all different links in the chain.
That's right.
You know, one thing I'll say as we close this one out is that it's one thing to have a scary patient when you're in the hospital with support in a controlled environment. Yeah. But it's another thing. I've been on some ride-outs where you're on the floor of the dining room table intubating a patient with a crowd of people you're afraid are going to get into a fight or fight you.
Different world.
You know, it is a different world, and I hope that some of my colleagues would have some ER kind of EMS experiences, like go on a field trip with your local fire department. See what they do, see what happens.
Especially some of those grumpy old nurses. Say that. But,
so you are a nurse.
No, they've gotten a lot better. The nurses are, they're a lot better. They understand a lot better what we do and how we work together. Yeah. It's not like 20 years ago it was a little bit different, but now it's a lot better than it used to be. But yeah, that would be beneficial for them to come right out and see what we do. And sometimes they get mad, well, why didn't you guys do this? Well, because I was on the floor of the living room and the family members were about to shoot each other or whatever the case may be, you know? Like,
actually happened in a ride-out.
Yeah, we had to load and go, bro. I didn't have time to play around. But
one of my paramedics, as we're leaving, the arm flopped out of the gurney just as they're going through the door, and and the family saw that. It was a bad situation, and they've had to back up, and it triggered.
Oh, I'm sure.
Anyway, it's a tough environment out there sometimes. Well, these are good stories. Yep. So many more we can tell.
Oh yeah, we'll tell more later.
All right. Be
See
safe out there.
Thank you for listening to EMS, the Erik and Matt Show.